All right, hello again, and welcome back to our second panel. On behalf of the whole Psychedelics Go team, the Canadian Securities Exchange, and the Psychedelics team, thank you for returning to this incredible event that we are hosting today over the next couple of hours. I hope many of the attendees were able to attend our first panel topic discussion, Clearing the Haze, What's Legal Today. It was absolutely fascinating, full of some of the bright thought leaders and emerging companies in our space. There's also a breakout session after each panel, which I would encourage everybody to attend, but we're going to get right to our second panel of the day. The topic is ketamine clinics, do's and don'ts. Ketamine, one of the world's most commonly used drugs for more than 50 years, has recently evolved as what can only be described as a phenomenon in treating severe depression and other mental health disorders. A recent boom in the proliferation of ketamine infusion clinics opening up across North America has left many wondering what these means for behavioral healthcare treatment and how to succeed in this new industry. Today's panel will focus on the logistics of opening and operating a ketamine clinic, given the complex interplay of federal, state, and local laws. We have an incredible group of content providers. I'm pleased to introduce the moderator for the ketamine panel, my colleague, Tegan Joan, founder of Acid Channel Inc. Tegan is an experienced chief executive officer with a demonstrated history of working in different areas of development, skilled in ESG and corporate social responsibility, sustainable business management, community engagement, and policy analysis. Tegan has a Master's of Science focused on integrated studies from the University of British Columbia, and she's going to be our fearless leader for this afternoon's panel. Tegan, take it away.
Cool, thanks, Paul. Nice to see you, and nice to see everyone on our panel today. All right, so welcome everyone. We've got a really exciting discussion to have. I thought what we'll do is we'll start with a round of introductions, and everyone can turn on their video and say who they are, what their background is, and what got them into psychedelics, and a little bit about their company. And then we'll open up with a few questions for discussion. Zain, do you want to start first?
Hello, sure, yeah, I'd love to. So hi, I'm Zain Hassan. I'm the co-founder and chief medical officer of New Life Health, which is a public benefits corporation focused on building a digital platform for patients and providers. We're really trying to personalize the care of patients looking for innovative therapies for mental wellness, including psychedelics. And we are focused on solving for the barriers of patients receiving high quality integrative mental health care.
Cool. Awesome. And so why don't you talk a little bit about what got you into the work that you're doing now as well?
Yeah, absolutely. I'm a big fan of the work that MAPS is doing. Very excited for MDMA to get FDA approval for PTSD and other conditions. And really, we pay very close attention to psychedelic integration. And we know that psychedelics are really a catalyst. And so I think the biggest barrier for successful psychedelic therapy, including ketamine therapy, is developing digital tools that are going to help support the patient therapist interaction or the patient provider interaction, because ultimately once MDMA becomes legal, the estimated cost of the entire treatment with all the psychotherapy involved is like $25,000. The length of time that patients spend in those therapies.
Wow.
So we're really trying to bridge that and trying to make as maximal of an impact in the psychedelic experience as possible. And I think that that's going to come from personalization of the therapy. There's music is a big determinant of the outcome, and so we're really trying to investigate which music for which people provides that effect, and then all the other variables which we can talk about.
Cool. So finding a new way to make it not cost 25 grand to service your mental health indication, hey, sounds like an admirable project to work towards. Why don't, Matt, do you want to also, I think we'll just go through the introductions here first, but do talk a little bit about what you're doing, because we'll lead that into some questions that bring everyone together. Matt, do you want to turn on your video as well and just say a little bit about yourself and your background and what you're working on?
Of course. Thank you so much for having me. So my background is about 20 years in the cannabis space. As an owner and operator of a company called High Times, pioneer of cannabis media and events. I founded Delic about 3 years ago with my wife. We are the world's first psychedelic wellness corporation with a focus on really building a framework for safe and effective psychedelic wellness. So right now we have a media site that gets a couple 100,000 people a month called Reality Sandwich. We have an event series called Meet Delic happening in November 6th and 7th in Las Vegas with people across the world of science, health, technology, wellness, comedy, business, everything around psychedelics. And we have a lab in Canada with a Health Canada license for psilocybin and cannabis. And we are acquiring a chain of ketamine clinics, which is, I think, the main topic for today. For me, ketamine is incredibly personal. My wife has a anxiety disorder, and about 2.5 years ago, we found ketamine, and it is the most effective thing we've found for helping with her anxiety. So it's been incredibly powerful and effective force in our life, and that's really why we've kind of zeroed in on trying to make it available and accessible. And so we're really focused on places that don't have a lot of good, effective care right now. And the chain that we're taking over is set up in Central California and Arizona, and we're expanding it outwards and really want to make safe and effective psychedelic wellness available to everyone. So that's kind of my background and why we're doing it.
Wow. Yeah, just a little company, High Times, hey? And now a huge major expo event planned for Vegas. So it sounds like there's some more fun in store for everyone here with this industry, right? As we see who's starting to join. That's awesome, Matt. So Ali, do you want to turn on your video and give an introduction as well and say a bit about what you're working on?
Yeah, for sure. So my name is Ali Mohammed. I'm the co-founder of Light Clinic, the co-founder and CEO of Light Medical, and the founder of the Telemedicine Association of Canada. I've been in cannabis since 2016, and our focus has always been as looking for alternative ways of treatment for patients that weren't focused so much on narcotics and opioids. So for me, psychedelics was a natural transition or a natural evolution of what we're trying to do when it comes to getting our patients better treatment and better care. I'm really excited about where the psychedelic space is going, especially in the ketamine space. We currently work with clinics that provide Spravato, and we're hoping to get more into the clinical trials and allow better access, better education, and all of virtual offerings for our patients. We're a completely virtual clinic, and we believe in psychedelics, ketamine, and everything that this has to offer.
Awesome. Thanks for that. At it since the early days, hey? So we got some OGs here, like everyone, it's really exciting to see. Ronan, do you want to give your video on and give an introduction as well? Oh, it's on mute there, I think.
Yeah, sorry, I have a fancy microphone in front of me that mutes things easily because it picks up way too many kid sounds in the background. So, hey everyone, thanks for having me. I'm one of the co-founders of Field Trip Health Limited. We're the largest vertically integrated psychedelics company out there. And what I mean by vertically integrated is that we are focused both on building the clinical infrastructure to deliver psychedelic assisted therapies, working with ketamine, primarily in North America, as well as with psilocybin in the Netherlands, and scaling across North America presently, as well as doing drug development work on the next generation of psychedelic molecules, because what we believe deeply and what the evidence suggests is that the contextual situation around the psychedelic experience matters. So you have the pharmacology plus the context. And as we looked out and the evolving landscape, we realized that people are focused on one side or the other, but given the deep interplay, we thought both from a therapeutic perspective as well as from a business perspective, you wanted to be involved in both. So you could pull the levers dynamically as you develop your therapies as well as your new molecules. We also have an app called Trip, which is designed to support people through any sort of non-ordinary consciousness expansion work. Non-ordinary consciousness sort of states and consciousness expansion is what I meant to say. So really excited about the cultural and social impacts of the psychedelic renaissance beyond just the medical as well.
Awesome. So you guys have been rapidly expanding too, hey, like full steam ahead. And it's really exciting to see the public uptake in these products, right? I think a couple of years ago when people started talking about psychedelics, no one was really sure what was going to happen, right? There were a few kind of cowboys and ringleaders and everyone was sort of mixed reviews in your legal office. And now we're sort of seeing like ketamine's really neat because it's easily accessible, right? And you can actually roll it out right away, which is giving people access to product in a way that's not possible for a lot of other molecules. One thing that I thought was really interesting, I'm curious to see between Ronan and Zane, what your experience has been with music in particular, and working with these products, because I know Zane was mentioning they've been seeing some research and looking around at different music applications. And I'm curious to know if you guys have anything to say about that as specific to ketamine. Yeah, can you speak to that, or any music in particular? I think is something that's kind of neat.
Zane, I'll let you go first.
Yeah, sure. I'd love to. So I think there's a lot of research coming out of Imperial College of London, and Robin Carhart Harris and some others have kind of looked into this. There's actually a paper called The Hidden Therapist, where people were kind of reviewing patients' aesthetic preferences in music and kind of putting them through these therapies and using a control playlist and really just trying to dynamically assess what are the features of music that actually lead to a better clinical outcome. And so there's a lot of different features, and there's a lot of different scales that they used to kind of create this framework. And we think that, you know, the personalization of ketamine therapy, there's a lot of features to it. There's the psychotherapeutic integration. There's you know, the aftercare. So we just think that the music could help enhance that therapeutic state and make people more open and maybe share more through the integration process. We know that there's definitely some music that creates problems. So if you have a clash of aesthetic preferences when you're going through these experiences, that's really going to create a dysphoric ketamine experience. And I think probably all of us have seen dysphoric negative experiences with ketamine. Some of that, you know, has to do with set and setting. You know, some of that has to do with the trauma history. You don't know when you're going to re-traumatize someone, you know, who's dealt with a lot. So, you know, music could be that kind of, again, dynamic lever that you're able to kind of lead people out of those dysphoric experiences.
For sure. And sounds like, so how's that looking in a clinic? Like if someone goes into a clinic, can they go in and then what happens? Like if in terms of picking the music or understanding what kind of music that person might like, does the person pick it? Does the therapist pick it? How does it all work? And what sort of comments or results are you seeing out there on this?
Yeah, well, we're working with a musicologist who's part of the Music Genome Project with Pandora. And we're really just trying to understand a framework. We're trying to develop one ourselves. And we're kind of using our app and the digital platform to kind of track these outcomes and to get feedback. But ultimately right now, it's just all in the research stage. So we're using the known frameworks and we're kind of just seeing how it works with our patient population.
Cool. And Ronan, how about you? Have you guys been delving in anything on the like sort of music therapy or alternative therapies that aren't normally seen in clinical trials? What have you guys been seeing out there that's got your attention?
Yeah, so within our clinics, we're working with Wave Paths, who I think is broadly acknowledged as one of the leaders, if not the leader, in focusing on psychedelics and pairing the musical dynamic to the psychedelic experience. And so we're not trying to recreate the wheel, at least within the clinical context, the medical applications. We're doing some fun stuff with Trip, though, our app. We recently announced that East Forest, who's a reasonably well-known musician, who's also a very experienced psychedelic guide, has been developing music. He produced an album called Music for Mushrooms, and his follow-up is actually being released exclusively through their Trip app. We're working with artists like Superposition, as well as a dynamic music generation company called Lucid in Canada. So it's an area that we're working with, but our focus with Field Trip is, instead of trying to create do clinical work, more focused on big data. So we're not trying to control all of the dynamics. We're trying to offer up a number of different aspects and just collect the data to try and see what works on a big data machine learning kind of basis, as opposed to, you know, pulling the levers at any given time. Both, I think, are relevant and very powerful and useful. And I know the work Adam Ghazali is doing at University of California, San Francisco is related to as well. And I think all of us are pulling in the same direction, because context matters. I think when it comes to psychedelic therapies, particularly in a medical context, I was just on a panel with Katya from Compass Pathways earlier, and she said, like, one of the most important things, and I agree, is how do we develop predictive, personalized, and consistent psychedelic experiences and outcomes? And there's so much work to be done. So anybody who's adding to that knowledge base, I think it's laudable, and we should all be supporting it.
Awesome. See, it's interesting because I think one thing we forget is everyone around here is seeing this stuff every day, right? Like you to speak so casually about it, like, yeah, now we're trying out these different modalities and whatever, right? But this is really groundbreaking stuff. Like, it wasn't always that you could say, hey, I want to go to the doctor and get high and listen to some music and talk to a therapist and see what helps, right? And like, how cool is that going to be, especially with everything that's going on with the pandemic, right? Like, sign me up, 18 months in the home office. Like, I want to go lie down, right? So I think it's really, really neat to hear that these things are actually happening, and they're happening so fast. And maybe Ali, that might be a good segue into what you're working on, because Ali's been obviously experiencing the surge of the pandemic in the telehealth industry as well. Do you want to talk about what that's been like over the last year and a half here with the pandemic and everything else?
Absolutely. Yeah. So we've definitely seen an uprise in telemedicine use, and more so the acceptance of telemedicine, and people understanding the value of it. There is obviously a major place for in-clinic, and the therapies that we get while we're in physical clinics, we can't change. But to alleviate some of the stress of outside of the clinics, we think that telemedicine can be a huge plus for, especially when we're getting into the clinical trials, when we want to check on patients on how they're doing at home. We believe telemedicine can really alleviate some of that stress, especially with the travel, and mitigate some of the hardships that they go to when they are trying to get a physical clinics. We've seen a huge adoption of elderly patients trying to get involved, and also a huge adoption of people looking for alternative medicines. The mental health cases have gone up during the pandemic, and that's something that we're dealing with and treating every day. And using alternative types of therapy like this one and ketamine is definitely much more a better solution and a much more natural solution than some of the other offers that have been given up there. So we've been very excited to be a part of it. We're very excited to kind of get into the clinical trial sides of it all. For us, when we were in cannabis in 2016, I think one of the biggest hurdles that we had was proof, was actual trials and education around products. I think that with the psychedelics going more of the clinical trial route, the acceptance and the adaptation rates will be much higher, and we're happy to be a part of that program. So we've definitely seen a major uprise, and we're hoping to continue to help patients along their way and keep them virtual as much as we can.
Awesome. So, and what have you been seeing in terms of trends about psychedelics? Like, has anyone reached out on the cannabis side at all and asked about it, or have patients been curious about it? Like, I know for me, even just on my LinkedIn profile, right? People are always sending you a note, hey, where do I get the drugs I want? And like, uh-oh, consumers, patients, right? So I'm always curious, because I'm not out on that side of things. I'm always curious to know what everyone's seeing, right? And what the different trends are that people are calling in about.
No, absolutely. Every day we're being asked for multiple different methods of therapy, from ketamine to psilocybin to DMT to MDMA. Our patients are curious. A lot of our patients are getting off of them. A large portion of our patients have actually been in the narcotics and opioid space, and they view cannabis and they love it. So now they want to continue different types of treatments and therapies. So they're very intrigued by the opportunity of psychedelics coming to market. They're excited about what will be available very shortly, and more so, they're looking to be more educated. Our patients really want more education around psychedelics so that they can actually make a better choice and decision once they become available and readily to use. So no, absolutely, Tegan. We get calls every day wondering when we're going to be really doing our deep dive in it, and I think it's going to be a very short period when we are.
Yeah, there's a huge consumer demand for this, and patients as well. I'm always kind of curious, like which word do I use depending on which jurisdiction I'm in and what's politically correct that day. But I think, you know, Matt's going to be a good person to ask about the general public over there with his experience and background. Matt, do you want to talk a little bit more about what you're doing with this clinic rollout and this event and everything, and what you're seeing out there? Because I bet you've got like a really good public understanding of what's going on.
Yeah, and people do always ask for drugs. You're right. It's kind of crazy.
Yeah.
No, I've gotten that when it was High Times, and I remember Matthew McConaughey came up to me one time, and he said, "You know, there are dry times and there are high times, and this is the dry time." I thought that was a great ask for weed. Yeah, I mean, you know, I think people are actively looking for ways to help their mental health, right? And I think it's a major issue that is compounded daily by the last year and a half worth of unmitigated shit show, right? So it's like you have a ton of people. I think one of the big things about psychedelics is making you feel connected to the rest of the world and yourself. People feel super disconnected. So, you know, I think it's just, there's a huge opportunity now to help folks really help themselves, and just the current crop of psychopharmacopoeia just doesn't actually work. There's no actual, you know, you're talking 4 or 5% efficacy rates a year for the drugs that are out there for people, where psychedelics are showing, you know, 50, 60, 70% efficacy. So it's an order of magnitude better. And I'm just, you know, for me, what I've seen is just this intense yearning for change and for something better. And I think psychedelics have that. I think ketamine is incredible. You know, we're working on, obviously, on the ketamine clinic side, being very accessible, working with insurance and as ketamine, and trying to make it affordable so that people can get help who might not be in the you know, the highest socioeconomic stratus, and making it so that it's you know, really available. I think what we're doing with Meatdelic is just trying to bring together as many great people as possible in a space. And you know, what I did when I brought the Cannabis Cup to America was just bringing a bunch of cannabis folks together in a room for a couple of days, and it really did spark new and amazing things. And I think we're still at that stage in psychedelics where there's a lot of new awesome things that are going to come out in the next 2 or 3 years. And it's just, you know, really wanting to be you know, that accelerant and that place for people to connect and really expand this industry, because I think it's just so much, you know, it's still very much a first inning right now. We're still in, you know, there's one legal psychedelic available with FDA clearance right now. There's going to be way more. Like Ronan was just on with Katya, and you know, Katya and George are putting in their data sometime in the next couple months, and we'll have a psilocybin product. You know, knock on wood, but we'll have a psilocybin product. We'll have an MDMA product. We'll have hopefully an acid product. I like your acid thing on there. You know, I know MindMed's working away on that. I think all of these substances have incredible efficacy, and we just need, you know, it's about investing in that. And then I think, you know, you have places like Jamaica or Amsterdam or now Oregon that are allowing psilocybin. There's going to be therapeutic use without FDA compliance. So I just think there's so much that can be done. It's super exciting. And, you know, it's just about getting people well, really. It's about giving people an opportunity to get well and not be stuck on some pharmaceutical drug every day in a kind of sticky haze where you can't, you have no up or down. You're just kind of in the middle and nothing's great. I've seen too many friends and family stuck in that. And so it's, you know, for me, it's a huge passion project. It comes from my love of psychedelics, right? It's the reason I started at High Times 20 plus years ago, was, you know, doing mushrooms in Amsterdam, and I'm a big fan till now. So I really just want to push this forward.
Matt, when I was talking to Bruce Linton about what was happening with psychedelics in the early days of his involvement with MindMed, he kept reminding me that we shouldn't talk about antidepressants as the conventional treatments. We should refer to them as the historic treatments, because he's like, they're so far gone. But I really like the expression sticky haze. That delivers exactly what the experience on antidepressants sounds like. So I'm going to adopt that. I hope you don't mind.
No, please. Take away. I really feel like it's so important that, you know, all of us and all the other folks who are doing this just get as much of this out there. And I think it's super important that, you know, capitalism is the prevailing dominant paradigm of our, at least, you know, our nations, you know, most of the nations in the world. And if you don't bring in capital and you don't bring in workers and jobs and all the other things, then there's no voice and there's no community behind it. And so it's the same thing that happened with cannabis. Now that there's hundreds of thousands of people and billions of dollars in income, you know, Connecticut legalized yesterday. It wasn't even the front page of the news. It was just like a whimper. It's like, oh shit, another state. Like, it's just, and I think you'll see a similar progression with psychedelics, because the work and the power and the, you know, the data that Ronan's collecting and all of these different pieces are going to come together and show people, and the apocryphal stories of your aunt or your grandma or your friend who took a ketamine treatment and is now not stuck in anxiety or not stuck in depression, and they tell their friends, and it changes the world. Those little stories change the world much more than trying to tell people that they're wrong about the war on drugs.
For sure, right? There's lots of personal stories coming out in the psychedelics industry. In particular, like cannabis was one set of stories. And, you know, there was a lot of vets and chronic pain and sleep, I think, at the beginning as well. But psychedelics, like the sort of untreatable things and the unexplainable things and the things, the kind of patterns that people have that they can't understand why they keep happening. It seems like we're really finding a lot of different ways, and specific to your point, it's personal to the individual, right? And a lot of that makes it the challenge for the researchers to design trials that can still be accepted with the standards that are needed to get the drugs approved, right? But that are still personal. And I think that's where we're seeing a lot of work right now as well, right? And no one likes going to the doctor and being told, hey, you know, now you're majorly depressed, right? Or now you have an eating disorder, or now you're anxious. Oh, really? Before I wasn't. I was just kind of concerned. I didn't know what was going on, right? So how do I navigate this? Is this bad? You want me to take a pill? What am I going to do with the pill? I have to go talk to someone. You know, I don't think anyone likes the way things are, and that's part of why these treatments and these different integrative models are coming out hot as something new. And I really think after you know, a year and a half of a global pandemic, people are looking at things differently. They've been through, their lives have changed. Almost there's no one that can say their life is still the same. Their lives have changed, and they're looking at new drugs, they're looking at new treatments, and they actually want to try things out, right? Otherwise, to your point, like capital markets, I think is a really interesting tool to drive an industry. And you know, one of the reasons I first went into psychedelics, my goal from a young age was to convert as much of the capital markets ticker symbols over to plants as possible. And I think that this industry is one that we can do that with. And we can also have a lot of fun with these clinics. So I was going to go over to Zane. Do you want to talk a little bit more about what you're doing over there as well? Outside of music, what kind of different results, or can you talk any more about just like the trends that you're seeing? Because you've been doing like a specific area of research with New Life, right? And do you want to talk about what's different over there?
Yeah, sure. So New Life is just broadly focused on any kind of innovative therapies for mental wellness. And I'm actually glad you brought up, you know, the kind of the interaction that you get when you go see a doctor about, you know, let's say an eating disorder or depression. It's usually a 15-minute conversation and 9 questions, and they put you on an antidepressant. And that's unfortunately, you know, the model that we learned and need to unlearn, you know, in medical school in the US. And it's actually because it's just more labor intensive, and, you know, just, you know, there's additional training required to actually have an integrative approach. And, you know, at New Life, we're really focused on that. You know, the integrative approach is really The simple way that I describe it is that it's the root causes of what's driving the depression or the anxiety. And in a lot of cases, it's trauma. In some cases, it's biological. We always, in even traditional psychiatry, you screen for anemia, thyroid dysfunction, and you look at vitamin D levels. All of these are powerful, effects. And there's an entire kind of curriculum now with the Integrative Psych Institute and the work of Will Vanderveer and Keith Kurlander. They've put together a year-long fellowship, which is really amazing. And it's really just kind of being able to disseminate that medical framework, that integrative framework to more providers. So more providers take the time to spend with their patients and really see what are the other things that are driving their symptoms, instead of labeling them and assigning them to a drug. Even ketamine, treating depression that's driven by something else with ketamine is not going to be helpful.
Mm. And so, and I mean, I'm hearing these words, the integrative model, a lot. And do you want to talk a little bit, Ronan, also? I know you use those words as well. When you guys say integrative models, what do you mean? Are you talking about trying different drugs, trying different therapies, trying different scenes, or do you want to just talk a little bit more about what's included in that and how it's different?
Sure. I mean, the word integrative model or integrative in medicine has, certainly a distinct meaning. And that's actually one of the areas I'm most excited about for psychedelics, because we talk about psychedelic therapies right now as a part of an allopathic regime, which is treating what's wrong as opposed to being proactive or integrative or functional medicine, where we try to prevent wrong from happening in your body. And I think psychedelics fit so well into that mold, because we know that your mental health and stress has effect on gut health, and gut health has an effect on your inflammatory system, and inflammatory system has effect on basically every chronic disease out there, in a nutshell. So I'm super excited about that, but that's not what we mean, at least right now within Field Trip. What we're talking about when we talk about an integrative model is, when you talk about psychedelics, you're talking about experiential medicine, that the context, the set and the setting and the therapeutic protocol that gets paired with the drug is probably as important as the drug itself, and so, just yesterday I was giving a talk. What this means for the emergence of the psychedelic industry is that brands are going to matter. That it means that Google reviews are going to matter. It's going to mean that Net Promoter Score matters, because you can call it the placebo effect. I like to call it the actualization effect. But the more people believe they're going to have a good experience, the better experience and the better the therapeutic outcomes are going to be. And that seems to be an essential part of psychedelic medicine, because when you get into these clinical trials, you can't really blind a psychedelic clinical trial. Historically, psychoactive and psychotropic effects were seen as an adverse experience in a drug trial. Here, they're the intended experience, and there's no way to successfully blind people. So we may actually be operating in a regime where the placebo or actualization effect is the primary driver of the outcomes, which also is a wonderful thing, because I think to some degree we've lost a little bit of the thread with science and medicine, which is everyone's focused on, does this drug work, as opposed to, are people getting better? They're very closely linked, but they're different conversations. And so with Field Trip, we're just trying to lean into that. We fully believe in the clinical research that needs to be done, but at the same time, we want to create the paradigm and the environment where the context can be supported and people believe that they're getting better. From even starting with the narrative, where I try to encourage, although it's a bit of an uphill battle, our clinical staff to stop referring to people as patients. We should just refer to them as people, right? They're just people. Everyone's sick. Everyone's healthy at various times, right? It's like starting at that sort of elementary level. That's what's exciting about psychedelics, is that we can kind of go to base level and say, like, what is working in healthcare? And there are a lot of things that do work and what's not. And there's a lot of things that don't work. And we get to an opportunity to fix a lot of the things that aren't working right now, and just reframe the conversation to be much more constructive, much more integrative, and much more supportive for the average people.
The actualization part is really interesting, right? I think that's really the ticket there in making these products, like finding these fast track ways, is quantifying what someone believes as actualization, right? And I really think that's a fascinating area of work to go into. And like what's happening now, again, with this like immediate access to these products, right? And people are finding new ways to find beliefs outside of, you know, their religion, their culture, their home. Or lots of people that don't have religions or cultures or somewhere to call home are finding something that they can, right? They can identify with, and they can find other people that have similar experiences with them. Ali, how about on your side? You've been sort of partnering with a whole bunch of different kinds of clinics, right?
Yep.
In terms of adoption of ketamine and the ketamine product, what are you seeing out there for the product as well, and clinic expansion options?
Yeah, I know we're starting to see again, like we're starting to see that people, not our patients, the people are actually really starting to enjoy the product and seeing a difference in their health, and getting away from the pharmaceutical side is exciting for most of the people that we're working with. A lot of these people are dealing with severe pain, and for them, getting into a pain clinic and working with things like Spravato has been extremely beneficial. So for us, we want to consistently help grow that out, continue to help educate these patients and watch the growth. So for us, we've teamed up with a lot of pain clinics that specialize in alternative treatments, in psychedelic treatments. And for the one that we're working with now, ketamine, we've seen a great response. So for us, we continue to work with the same clinics. We continue to grow out our clinic networks, and we continue to try to get more people along this pathway of better treatment. And on our side, from the Light Clinic side, whenever we have those people coming in for that kind of treatment that are looking for alternative, now we're pushing them to our pain clinic partners that focus on ketamine treatments and for future psilocybin treatments, because we believe it's the right way to go. And I agree with you. I think if we can get people back into that preemptive healthcare, that's one of the biggest grifts that we have is that most people now have to wait till they're extremely sick before they acknowledge anything, just because of how difficult access can be, how much of a pain it can be to kind of get those kind of treatments. So for us, like Ronan was saying, if we can get patients into preemptive treatment, start focusing on them today and make sure that they're good for tomorrow, by teaming up with these kind of clinics, it's going to be hugely beneficial. So we are seeing a great rise in it. And for us, we want to continue the ease of use, the ease of access, and make sure that these people have anything that they need right at their fingertips. So for us, it's exciting. And I love seeing people getting off pharmaceuticals. So for us to be a part of that process and encouraging it, it has been great.
Yeah, right. So I think it's really interesting as well. Like, I'm just still fascinated by what the pandemic is doing out there to mental health, just because it changes every day, right? Like every day you're at work and you're figuring out what you're gonna do, and then something else changes with the pandemic and in healthcare in particular, right? It's been a crazy ride. And I'm really curious, like with the telehealth application, I think, after hearing Ronan talk about the actualization process and sort of a bit of information there, like I'd be really curious to see how telehealth could help support, like almost like a primer, right? Like, here's what you need to do to believe. It's almost like a Tinkerbell in Peter Pan, right? So I'd be really curious to see what sort of adoptions are going to be possible on that platform as well, to sort of gear people up to something that could be a bit more intense, right? You can kind of have some more access points to people and warm them up to different routes of psychotherapy and drug administration.
Yeah, I think that we're gonna have to for this. It's definitely gonna have to be the hybrid model. So it's got to be a combination of both telemedicine and in clinic, so we can have different types of treatment like the one that Zane has. And like Ronan was saying, I don't think that there's an end all be all. I think that there's going to be a multitude of different practices and different therapies that we're going to have to work with patients to understand what the best route for that patient or those people are, because I think it's going to be a combination of both technology, in clinic, therapeutic. It's going to be we're going to have to work together, and as long as we have that person's best interest in mind, it's going to be a great experience. So I'll encourage them to go the route that we're pushing them on, maybe through telemedicine, then through in clinic, then through different type of therapy modes. But it is going to have to be a hybrid model. It's going to be one that it'll be good to have us working together and continually focusing on that person.
Mm-hmm. And then, so Ronan, you've also got an app, right? Do you want to talk a little bit more about what your app's doing as well? Because that's also really neat how that's
sure.
right?
Yeah, absolutely. We actually have two apps, one app and one digital application. The app called Trip it was inspired right after Denver decriminalized psychedelics. I guess, gosh, I've lost track of time. I guess that's one of the functions of the pandemic as well. But a couple of years ago, and we realized that there's going to be an extremely large audience of people who take decriminalization for tacit legalization or tacit approval, which it's not, but I get where people start to think. And so we realized that one of the biggest risks to the overall paradigm in the zeitgeist that's happening right now is someone going out and doing something really, really stupid, which engenders a potential political backlash or medical backlash or anything along those lines. So realize that there's a unique opportunity, both from a brand building perspective and a community building perspective, but also from a harm reduction perspective, to take all the tools and the protocols and the practices that we work with in clinic, simplify them, synthesize them, and put them out there. So if someone is going out and doing mushrooms for the first time and isn't doing it with someone who's experienced and knowledgeable, at least they have some degree of foundation to be informed, thoughtful, create a safe setting, and so on and so forth. And so that's what TRIP has become. It's really a tool to support consciousness expansion through non-ordinary states of consciousness with music, with a very structured journaling tool and information and content. That's really the foundation of it. On the other side, we're also building a tool called Portal, which is going to kind of be our digital platform for patients coming into the clinic. And what's really exciting about that is that we're leaning into not only using it as a medical a medical tool for interaction with patients, but also to support the journey. One of the complaints I've heard about just therapy in general is that it feels like a road you start on and there's no clearly defined endpoints and you never get off it. And it's hard to track your progress, right? It's very, very subjective and it goes up and down. But with a tool that makes the journey a little bit more structured, where you can see the defined endpoints along the way and show your progress, you can really enhance the patient experience. And so those are the two digital tools we're building within Field Trip as well.
So that's like all of this stuff right now, having this all accessible to anyone with a device opens up a whole other box of questions, right? And I'm sure, like, I bet Matt might have some good comments about how the parents have been on this one. I mean, I'm seeing in the chat there that there's a lot of interest in epilepsy and seizures, and that always makes me think about the early days of cannabis with Charlotte's Web and how that was a big pusher, a big driver to get cannabis approved for different drug use, right? Was the epilepsy and the seizure applications with the kids. I wonder, Matt, what have you been seeing or hearing out there in your sort of like huge retail rollout and public event show? Are you seeing anything from parents and children or anything of that line as well? What are people saying?
Well, I think, you look at exactly like Charlotte Figge and her mom, the work she did to really push for legalization and medicalization of cannabis. I think there's a bunch of folks who are pushing in a similar manner for the either medicalization, therapeutic benefit, or just overall legalization of psychedelics. I think it's a little bit older, right? I don't know. I'm not hearing a lot of 6-year-olds who are looking for psychedelic substances, but
yeah, right.
I think it's more tailored towards folks who can't, who have major depressive disorder, bad PTSD, but obviously after a year and a half like this, I think most of the population qualifies for some form of post-traumatic stress disorder. So I think it's going to open it up a little bit more. What I've been seeing is a lot of similar people doing work from the cannabis world. So like Sue Sicily doing some work on getting stuff around veterans that she was doing with cannabis, looking at that in the psychedelic side. I think there's a lot of folks who have done a lot of the ground game work on pushing for, at least on the American side of the border, legalization, who are now focused on psychedelics as the next piece in kind of repealing the Nixonian war on drugs, right? So you have people who see this as a pretty grave injustice to take away a healing plant medicine or even non-plant medicine that can help people live a better, fuller, happier more integrated life. So I think that's, as we program our event, there's a bunch of people on the activism and kind of that line between activism and medical work, who are kind of pushing for granting safe access to people for whom waiting years for the FDA to pass a substance that we know gives great benefit is unjust. So I think there's a lot of that, and I love what Ronan said, because it's something that I say a lot as well, that psychedelics are in fact a placebo effect, but it's the most powerful placebo effect anyone's ever seen, right? It gives you the focus is, well, does this substance actually make you better, or are you just getting better because you believe you're getting better? And I would say, does it really matter if you're better? Like, is there a real discussion there about whether you can't actually tie a direct correlation between taking a psychedelic substance and it physically making you better, or does it trick your mind into believing that you're better and then you are better? But if at the end of it you're better, I don't think that's a big deal for any of the people who would like to be better. I think they would really rather just do it and get better and not worry about whether there's a direct physical correlation, or if it's just one of the strongest suggestive medicine, substances, right? Each substance has a real version of suggestibility. If you give people a sense, and this has been like the underground psychedelic kind of world for 30, 40 years, is the facilitator will tell you to create an intention, to pull forward what you want to have out of it. Then they'll talk to you about it. You'll have that moment and experience, and then at the end you'll integrate in what you've taken from it, and lo and behold, most people will then have that which they intended to have if they're in a safe and secure setting and have really good people around them. That's the at least the majority of folks have that experience. So it's just, in response to your question, I think there's a lot of people doing this work. It's a little bit less child driven and a little bit more adult driven, just because psychedelics and the young brain, there's work being done on it, but I don't want to come out swinging and say 6-year-olds should be doing psychedelic substances. But I think there's a ton of people who are following that same Charlotte through line to really push for dramatic change by showing how their lives have been massively impacted for the better by utilizing psychedelics and getting change in their brain.
Yeah, it definitely seems like it's for the older crowd. We don't always see, I think also with kids and teenagers, we don't always understand mental health in the same way as well, right? You can have a moody teenager or an upset kid, and it's kind of, you might not notice what it could be resulting in later on in life. And it's definitely, I think a lot more work would need to be done. So it's interesting though to see that is one of the main differences, I think, between cannabis and psychedelics right now, is that this is really all for adult use, which could also help with the legislation changing over time, right? And I'm curious also, Ali, so you just launched the Canadian Telehealth Association, and you're working on like a 24/7 mental health platform, right? Which is really exciting to be able to offer. I think people really need something like that right now. And I'm curious to know, what have you been seeing also on the international front? When I saw in the news, the Telehealth Association was attracting a lot of different kinds of groups. Have people been talking about mental health? Have they been talking about psychedelics internationally, or like, what have you been seeing in your network there?
Yeah, so we've gotten people reaching out to us from Australia, South America, some parts of Europe, more so to mostly about the mental health side and understanding how psychedelic treatment can be administered. And for us right now, like we were saying, we were focusing on more of the therapy side and working on the availability of therapists 24/7. But the adoption is high, and people do want to get involved. And I think North America has always been the leader when it comes to the cannabis side, and now with the psychedelics, people are looking to us to understand how do we get the same kind of models, concepts, and clinics available abroad. So we have had a lot of interest in our organization in more so understanding, one, how does it work, and two, how do we make it available for us? So we are starting to become the leaders in this space, and I think it is our responsibility and our duties to build out programs that allow us to take this abroad in ways that it will start working effectively. You know, it's the attention is there. People are very interested. The mental health cases right now, as we can all see, are through the roof, and they're looking for better treatments and opportunities available for those treatments. So yeah, Tegan, we're getting hits from all over the world wondering how can we implement these methods and these models in their countries.
Right. And it seems like that's going to be a lot of the upcoming clinic expansion efforts, I would think too, right? Is sort of taking a look at these different countries and understanding what's going on there and what do people want and what's going to be different depending on the culture and religion and society and pricing and drug controls, right?
Yes.
It's really neat to see what's
Yeah.
going to be offered in different countries.
And developing strong partnerships with others in the space right now that gives us even more credibility to go there as a complete solution will allow us to move faster, move quicker, and develop a much better product in the very short-term future.
Yeah, and it's interesting, like it almost in some ways North America and getting all this stuff out in the news and capital markets and movies and Hollywood and everything, right, is something that I think the rest of the world is really watching, and you guys are really all leading the way there, right? Everyone's going to be looking to what's happened here in Canada, in the USA, and saying, what's going on? How come those guys are getting cool new products to market and they're all feeling a lot better, whatever better is, right? Or maybe they found a new definition of better and we want to know what that definition of better is. And that's what I think this group is really doing right now, which is so exciting. Zane, do you want to talk any more also what you're seeing on the international side? Like what have you been finding? Oh.
Yeah, sorry. We haven't really been on the international side. So I really can't comment too much on that.
You're not looking out? Okay. What about, I think what we'll do, actually, we're just out, I just saw the clock and we're just running out of time. I think we're supposed to open up for questions. We have a question there from Joe who's wondering about CAP in Europe. Is that, do you want to? Oh.
I think he means ketamine assisted psychotherapy.
Okay. So sorry, Joe, you mean ketamine assisted therapy in Europe? Yes. Okay. So there's a question for the panelists. Do you guys want to have at that one?
I mean, I can speak very briefly about it. In the Netherlands, we're actually working with psilocybin truffles, not ketamine per se, but I know there are some companies, Awaken Life Sciences, I think is the name of one, that's opening up ketamine assisted therapy locations in the UK. I haven't heard much in the way of continental Europe yet. Certainly at Field Trip, we're interested in it, but there's a lot of work and room to grow our business within North America. So that's been our strategic focus just because we're located here.
Yeah, and I saw Paul wrote Portugal there as well. I know that's one that I've been looking at too because of the decrim laws there, right? Has anyone been looking at that as a place to offer any products or services? Less, maybe a little. I think, yeah, Ronan, what are you going to say?
We haven't, we work exclusively within a legal paradigm. So decrim is not, at least for publicly traded companies like us on the TSX or NASDAQ, sufficient basis on which to work in those environments just yet. So it's something we'll keep an eye on. We could do ketamine assisted therapy in theory, but I don't know the specific regulatory environment for Portugal for that. But with psilocybin, it'll be hands off for us, at least for the time being.
Yeah, so that's interesting because I think my understanding is that I think some people are going and they're trying out, I think it was maybe Ali that was telling me that he heard also some other people are going to these different countries and trying to figure out if they can get drugs approved faster based on the regulatory environment there. I don't know, have you guys seen anything? Is there anything noteworthy that you've seen in that realm of research while you're looking around at what's getting legalized where and what the rules are like for getting sourcing the products and getting them to market? Yes.
I don't know if that's a question for me or not, but we have the general legal status where these things are legal is that they're not so much legal and regulated as they are legal and unregulated. So in Jamaica and Costa Rica and Brazil, where psilocybin at least and other psychedelics potentially are legal, it's mostly they're just considered food products kind of thing, and so there's not a whole lot of regulatory environment within to work. I don't see much in the way of legalization efforts elsewhere right now, but I'm sure that's coming, and certainly I think the model that Oregon is going to help establish will be the basis for all other locations, and certainly we see other states moving forward. California, Florida, Texas, they're all advancing some kind of work with psychedelics right now as well.
So, but ketamine you can go anywhere with, right? Or how is that all? Isn't that one of the main benefits, or what? How does it work there? What's the differentiation with ketamine and the rest?
I could
go ahead.
I can comment a little bit. It's interesting. The DEA is putting together a task force to review ketamine use in private clinics. And actually there's one of the larger manufacturers and distributors is Henry Schein. And they are restricting the sale of ketamine for off-label use in certain clinics. So there's definitely some different regulations coming around that. But yeah, ketamine is definitely legal in all 50 states.
Yeah,
Awesome.
I think when you look at other, other countries, there's, as Ronan said, there's some work being done in the UK, and one of the Scandinavian countries has a couple of clinics, but most of mainland EU does not for some reason. It's not the same regulatory structure, so you can't use off book the same way you can in America, and so it leaves it a little bit more non-direct, and you can't really just go in there and start giving people ketamine assisted therapy. You need to work through licensing, you need to work through it being properly prescribable for specific disorders, and then work through their local medical authorities to get the ability to do it. So that's just been the feedback I've gotten from the EU.
Times they are a-changing, hey guys. All right, Paul, I think we're handing it over to you a few minutes late here. Sorry about that. Do you want to take back the stage here and wrap things up for us?
Definitely. There's not much for me to wrap up. That was outstanding content. To quote one of my favorite authors, sometimes associated with psychedelics, it is a brave new world that we're in right now. And I think the pace of sort of socialization and acceptance is staggering. I'll say that cannabis was the Trojan horse that started changing attitudes and opening up doors. And behind that is a rediscovery of therapies that have, frankly, have roots going back millennia in all sorts of cultures and societies. And until as Matt mentioned, the Nixonian war on drugs, they were being studied at numerous accredited academic institutions such as Johns Hopkins. This is not a recent thing. So it's a credit to all the people that have added content to today's panel to see the future a little bit ahead, to peek around the corner before others could. And this is ESG. And to me, this is the ultimate ESG kind of business, because it is, while it has commercial applications, while we have public companies, while we even have unicorns, what we really mostly have is paradigm shifts for people in need, not patients, to Ronan's point, but people. And it really does sometimes take outre approaches and putting your name on something before it's got widespread acceptance to advance the cause. So I think we owe a debt of gratitude to all of the participants, not only on this panel today, but on all the panels that are being conducted, as well as all the participants that are not able to join us today. The world's going to be a better place. Mental health, I'll say the world is a reflection of the world's mental health, as is the mental health of the world, as is the world we live in. If we improve the mental health of the world, we actually improve the world itself. I think famous poet Rumi said, when I was young, I was clever. I wanted to change the world. As I got older, I became wise and I started to change myself. And I think that's what this is all about. So I think huge kudos to everybody on this panel, not for showing up today, but for what you've done to get here today and for the profound impact you will have on mental health in the world we live in. I want to quickly thank our sponsors that make today possible. That's Psychedelics Today, Global Go, the Canadian Securities Exchange, Zuber Lawler, and CFN Media Group, as well as PsyIndex. For all of our attendees, there's a breakout area right now. The link is being posted for the next half hour. You can continue the dialogue that has kindled all of this thought-provoking ideas. And then I'm going to invite everyone back to the so-called virtual main stage at 1 p.m. Pacific, 4 p.m. Eastern, for what will be our final topic of today's event. This topic is how to invest in the psychedelic industry. Actually, it's interested in investing in psychedelics, but I paraphrased well enough. So that's going to be in just a half hour. I hope as many of you as possible that weren't able to get your questions answered during the actual panel can join the breakout room, where I think you'll find that you'll be able to get responses or share opinions with other leaders and participants in this industry. Until then, wishing everyone well, God bless, and Godspeed. Thank you so much.